Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Glad that you could join us once again. You know, about 1.5 million Americans have lupus. It's a chronic autoimmune disease that it can damage any part of the body. And most of the people living with the disease, 90% are women. It's also 2 to 3 times more common in women of color. Now, here on the program to talk about lupus is Shanelle Gabriel, a poet, performing artist, and a warrior in the fight against lupus. Also here is Dr. Joan von Feldt, rheumatologist and past president of the American College of Rheumatology. They're going to talk about lupus and tell us how this disease is managed by the people who are dealing with lupus the most. Welcome to the program, both Dr. von Feldt and Shanelle Gabriel. Thank you for joining us on the program.
Thank you for having us.
Thank you.
Now, Shanelle, give us a bit of your background.
Well, I was in 2002, I started noticing that I was having headaches, severe fatigue, joint pain to the point where I couldn't put my bag on my shoulder. And I started losing my hair and just being really sensitive to cold and to sunlight. And about 1.5 years after first noticing that, I was diagnosed with lupus by my rheumatologist. And, it's a really challenging disease to manage. However, my rheumatologist and I, have definitely talked, and through open and honest dialogue, we were able to really come up with a treatment plan that's best for me. And lupus is a disease that doesn't always look like you don't always look the way you feel. And it has a series of times where it's more active and sometimes where it's less active. So, it's really important for me to communicate what's going on with me to my doctor. And also managing my disease also means doing the things that I care about, managing stress, and that's, through performance, through touring, through poetry and music. Those are things that bring me joy and things that make it a little easier to live with lupus, and connecting with the wider lupus community, having conversations with people who are going through what I'm going through.
So, doctor, these symptoms that Shanelle was talking about, this management of this disease, what is lupus?
So lupus is a chronic autoimmune disease. The actual cause is not known, but scientists do know that it's a combination of things, genetics, also the environment, and also one's own self or one's own hormones. For example, if I have a twin who has lupus, I have less than 50% chance of developing lupus. So obviously it's not just genetics, it's also the environment and other things as well. And it, as you said, it does affect women. 90% of those people who have lupus are women. About 250,000 people in the United States have the more severe form of lupus called systemic lupus erythematosus. That's the kind that Shanelle has. And in those patients, it can be life-threatening. So we're really delighted to be here and to raise awareness about lupus.
Now, you've mentioned a different type of lupus. Obviously, there are different types, different severities. You mentioned that the type that Shanelle is suffering from, is that the type that disproportionately affects women of color? Shanelle, is that what you understood when you were diagnosed? Or is lupus across the board affecting women of color disproportionately, no matter the type or severity?
So systemic lupus erythematosus is really the one that most people focus on, rheumatologists take care of. You can, for example, develop lupus from a drug as like a drug reaction. So in that population, it's different. But the majority of people living with lupus have systemic lupus erythematosus. And those are the people that are mainly women, 90% are women, although men can get lupus too. And when they get it, since the doctors don't think about it, and they take a while before they're given the diagnosis, they can be pretty sick by the time they make it to the emergency room or to the doctor's office. And it's much more common in women of color, 2 to 3 times more common in women of color.
Shanelle, in your understanding, what were some of the main factors? I know Dr. Von Feldt was talking about some of the factors that involved. What was your understanding when you were diagnosed as to what was going on and why it was going on?
I don't think, because I'm the only person in my family with lupus. I will say that. So I don't know necessarily what was the trigger or cause, because, there's so many different things. When you say environmental, that could be anything. But for me, I just noticed that I was manifesting all these symptoms, and I ignored some of them for a while. Some of them came and kind of left, and because a lot of times I was like stiffness, my joint pain started in the morning, but by the time I got to the doctor, they might have disappeared. I didn't think to say things, which is why it's really important to really be open and talk to your doctor about what you're feeling, even if it's kind of coming and going, because lupus is a disease that, it took me 1.5 years to be diagnosed, and I was misdiagnosed, or things were overlooked because we only looked at one thing, or I focused on this one symptom. And that's why I'm really glad to be working with GSK to raise awareness about this disease so people know what to look for, as well as how to get support and resources around having and managing your own lupus and being empowered that way.
Doctor, I understand that maybe Shanelle was diagnosed a bit faster than most of the women who are diagnosed. What is it about lupus that causes it to be misdiagnosed so many times? And what was it about Shanelle's situation that caused her to be diagnosed, say, in 1.5 years after her symptoms?
Yeah, well, 1.5 years is a long time when you don't feel well. But the problem is sometimes patients can present with a rash, and then by the time they get an appointment to see the doctor, it's gone away. And then it'll take another month before then they develop arthritis, and then the doctor starts to put the picture together. The primary care doctor usually puts the picture together, or at least is uncomfortable enough to send the patient to see the rheumatologist. But it's really very important for once the diagnosis of lupus is made, for a patient with lupus to have open and honest dialogue with her rheumatologist. I'm a rheumatologist for GSK, but previously I was professor of medicine at the University of Pennsylvania for 30 years. I just retired, took care of hundreds of lupus patients. And really, Shanelle is a wonderful example of the fact that she had open and honest communication with her doctor, and therefore her rheumatologist could design an effective treatment plan so that she's all this energy and brightness that you can actually hear. And a very good resource is usinlupus.com, USIN lupus.com. That resource is a way where you can find a checklist for symptoms, for example, or a diary. And that way, when you communicate with your rheumatologist, she knows the symptoms that you're having. It also allows you and introduces you to the wider patient community. It's really very important for other lupus patients to communicate with other patients so that they get ideas and they get energy from each other.
Now, once again, that website, Us in Lupus, where we can go and get some more information? Yes,
usinlupus.com.
Great. Thank you both for joining us on Health Professional Radio this morning. Been a pleasure. Thank you.
Thank you so much for having us.
You've been listening to Health Professional Radio. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. And be sure and visit our affiliates page when you visit our platform at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.